the last group discussion, you will take us along with you.
The final group discussion, we really want you to think about how you implement some aspects of what you have heard the last 2 days in your country. So you will find a piece of paper on your table where there are a couple of questions, and we'll ask every person to find a partner to sit with them and to really reflect on the presentation and information that's been given so far and to answer the questions on the paper. So we want you to identify one or two Work Package 6 outcomes which you would like to implement in your country. So this can be anything that you have heard. It can be something as big as the recommendations that we gave of how to implement multisectoral collaboration in preparedness and response plans, but it can also be just a small piece of information that you heard sometime during this two-day workshop that you thought, oh, that is something that I find really interesting, that is something that I can take up and really try to implement in my country. The thing that is important for us is that you really think about why this is a priority outcome for you, who you will need to implement this in your country, and what is your personal involvement. We don't really want you to think about something that someone else should do, but what can you work on implementing in your own country? And also try to be realistic about the time frame within which you can do that. And lastly, if you need help from anyone, do you need help from anyone here? Do you need help from anyone within Sharp or in a broader scope? So try to think about those things. You are free to kind of sit around for the first part, try to think about it personally. So we have 30 minutes for that. And then afterwards, you will sit in groups and you will share it with each other so that you can gain more insights, but also share suggestions with each other and also ask for help. You are free to think about it within your country. So if there's multiple people from one country, you can sit together and think about it. But you're also free to sit with someone else and think about it if you want some other perspectives. Are there any questions? Okay, well, have fun.
We are not really on the official time yet, but we see that so many people have to leave that we decided to do the wrap up and to close the workshop. First of all, I like to ask. Many people have left. Are there people who are somewhere in the building? They know that we should ask them back. Okay, we are kind of complete at the moment. First of all, just are there people who want to reflect on what they have discussed and want to share about their plans they have discussed to bring in their country? Because maybe the Dutch table, we had quite some extensive discussions as we have the opportunity to have several people involved in that. Maybe people want to reflect what our plans are, the main two for our preparedness plans.
Yeah, maybe it's because we are very lucky in the Netherlands that we are in the middle of the process of developing plan for the improved preparedness on a national and a regional level. So actually, quite some of these outcomes we are able to include those in plans. But we were especially discussing on stakeholder involvement. So which stakeholders should you involve and how do you know who they are? And when to start with such a process to analyze the stakeholders. Do I need the microphone?
Yeah.
Okay. So we had several discussions on how that could be done and that it would be good if there is somebody responsible for this task to identify who are the important partners and to develop a system where you can find the right persons and also how to maintain the details of the stakeholders. So I think that was a good idea, which we already discussed to include in the plans we are making now.
Yeah, thank you. I see also that it is a privilege that we have the opportunity to make such plans, well, we need still the final allocation of the finances and to find people to do it for the future. But at least I think this is a good opportunity. Other plans to share?
Just one small part of the yeah, of the multisectorial and preparedness and what should be done probably. And but it's more within the health sector what we can do. And what we already realized after the COVID, one thing is that we need to formalize and reconsider the structures within the health system and within the Ministry of Health, and we can clearly implement them in the state disaster medical plan. Those operational committees, which were developed on a way when we run the crisis during the pandemic, and which were not thought to be needed before the pandemic actually, but now afterwards we know that the just one crisis room in the Ministry of Health would not sort out the situation, and that we would need those operational working groups and work groups by the teams like the vaccination, international assistance, and so on and so forth. And we continue that with the Russian invasion in Ukraine and with the assistance in this crisis situation as well. We keep those working groups functional.
Yeah, that's a good operational continuation. Yeah. Any other remarks or ideas?
So we were, I think, the most international group here at the table. Unfortunately, most had to leave just now, so we are with 3 of us left. And I made a lot of notes there, and what I noted is, and maybe correct me if I'm wrong, is that you all had different perspectives on what you were going to take home. What I wrote down are things like awareness, common understanding, the need to formalize multisectoral plans, to make sure that that there's an importance to leverage on the personal connections, and also to work on also to improve the national preparedness plans. Why that was important was because people said it was important to benchmark activities, to again to formalize processes in order to sustain and sustain experiences, but also because, for example, people were moving, people are retiring, people that already should have retired are retiring now, and so you need to keep a kind of a historic background. And it was very important that what to take home is that the understanding that ministries and public health are not always at the same level, which has led to a decline in trust. And that was very interesting also for our Red Cross lady, that specifically also NGOs and other non-governmental organizations could play a very important role in those situations where there is getting a disconnect between public health and other organizations and the ministries, in order to keep the trust with the public, because they have a very important role at that point. Well, I'm not going to talk about all the implementation things, but it was what was important also, I thought, is the knowledge that you need to allocate time to think about things. And of course, then you come back to all the preparedness part. It's you have to take the time when you have the time. The reporting was important. There was also the group persons were all very much had all very much energy to start with using what they have learned to implement in their own countries, in organizing meetings and seminars, steering processes to gain goals, and the hierarchies of stakeholders, to inform the political level, writing what they've learned in the national plans. Hopefully, they stay in the national plans, and to work on stewardship, and the anticipated time frame is between 6 months and 1 to 2 years. So I don't know whether you discussed all that. And I was also very happy to learn that they still feel that Sharp could have a role in all this. So the as particularly with the Sharp experts, but also with regards to written outcomes or the further development of further consensus and dissemination of the results to EU level to make sure that you get more harmonization to work out at a more local level. There was the request for support from the lab experts, which is mainly, for example, work package 7, of course, and the use of templates and guidance documents, MOUs, and subs to be shared from the national countries. I think that's something very shortly to. So I had that's of course because we had all these inputs, and I don't know whether you have some additional things to add. No. So that's what we have. I've promised that I will write it out and come back to everybody.
Thank you for sharing the results of your table. Any other reflections? Otherwise, then I take the opportunity to reflect, to wrap up.